Hi, my name is Lucia and I'm a certified lactation counselor. I'm here to help you on your chest feeding journey.
My name's Kendra. I'm 26 and this is Leo. He's 4 days old.
I'm glad to meet you, Kendra. I usually start these visits by asking a few questions to get a better idea of what you're going through. How is chest feeding going? What are some of your concerns?
I have extreme nipple pain. They're sore and bleeding, and my breasts are also rock hard. I'm in so much pain I'm thinking about giving up and switching to a bottle.
I'm so sorry that you're going through that, Kendra. Chest feeding is challenging for everyone involved. I do see that right now you're moving with some discomfort. I do sense that you might be close to reaching your pain limit. Are you feeling pain now? When do you feel the pain? Is the pain unbearable?
Right now my breasts are sore to the touch.
Can you walk me through what you know about chest feeding?
I know I wasn't breastfed and that it's really important to me.
I'm hearing that chest feeding is important to you. I also heard you say that you're thinking of giving up and switching to a bottle. I want to reassure you that there are a number of things we can do to improve your experience and help you continue to chest feed. My goal is to help you resolve your pain and ultimately continue to chest feed. Do you mind if I ask a few more questions before we move on to talking about what the issue might be?
Not at all.
At this point, I would ask the client a few questions regarding birth history, if they received IV fluids. I would ask how long the baby is feeding at breast, how often the baby is feeding at breast. I would also ask if the baby is exclusively chest feeding or receiving additional feedings. I would ask what the baby's birth weight was, what the baby's weight at post-discharge was, and if the pediatrician has confirmed that he's gaining weight. I would ask if the mother is pumping and how often. I would also ask if she has tried to relieve nipple pain and with what methods. I'd also ask if the baby is using a pacifier.
Leo was assessed at the hospital and he doesn't have any tongue tie or other oral restriction. When we left the hospital, he'd lost 5% of his birth weight. He's had 4 wet diapers and 3 soiled diapers in the last 24 hours.
I'm reassured that Leo does not seem to have a feeding barrier that I can't help with, and that he's taking the amount of breast milk he needs at this stage. Given his age, 4 days, 96 hours, and the discomfort you're telling me you have, I suspect that you're experiencing engorgement, that your breasts are rock hard, your nipples are sore and bleeding, and that you are experiencing pain. However, leads me to think that his latch and positioning might need some correcting, and that you might need to feed him more often. At this point, I would review a couple of points before we go over how the baby is latched. Lactation physiology, stressing that lactation is a supply and demand system. I would review signs of milk coming in. Leo seems fussy. When was the last time he ate?
He ate about 3 hours ago.
Now seems like a good time to put Leo to breast since he looks fussy and could be hungry. Do you mind if I observe you, then offer corrections if needed?
Of course.
At this point, I would observe the client breastfeeding. I would review infant hunger cues, signs that the baby is getting enough, reverse pressure softening, and hand expression. While I'm observing the latch and positioning, I would verbalize and assist with correction if needed. I would show them other images or videos to demonstrate proper latch, or utilize a breast model and sock puppet, and then I would have the client perform a return demonstration. Kendra, frequent nursing or feeding the baby on demand is a solution for engorgement. You will be more encouraged to feed if Leo's latch and positioning are corrected.
Okay.
At this point, I would also review pain relief methods and wound care methods.
Thank you.
While engorgement is typically a problem noted within the first couple of weeks, Kendra, I do want to ensure that your wounds don't get worse. Does an in-person follow-up for tomorrow work for you?
Yes.
If your pain is not improved, I do still have some more tricks up my sleeve to reduce nipple pain while they heal, starting with the use of a nipple shield. If your pain is worse, then we can talk about referring to a lactation consultant or your healthcare provider. Meanwhile, please take this resource. It has links to videos on proper latch and chest feeding positioning, as well as numbers to call if you have other questions or concerns before we talk again.
Thank you.